feedback afterwards. What to consider months or weeks before breast augmentation for someone with regular anxiety attacks? Yeah, don't over egg it. Don't overdo it. Don't don't lay too much onto it. I mean, clearly this sort of surgery is going to be anxiety provoking for anyone. I mean, I can't say don't be anxious about it, because I think anyone would be anxious about it, and it's perfectly normal to be anxious about it, but don't be that anxious about it, and try and focus on the positives, on the reason you're having the surgery, on the effects that you can hope to achieve once you've had the surgery. So those are the sorts of things I'd be focusing on. In terms of the risks of surgery, you have to know about the risks, and you've probably been told the risks, and you've kind of accepted those risks before deciding whether to have surgery or not, because obviously you've got a decision whether you have surgery or not. And the risks are low, but they are there, so you have to be aware of them. But if you, once you've accepted that and think, yeah, the benefits outweigh the risks, I would just try not to think too much about the risks after that point. I think it's, I'd say, not saying don't think about them at all, but once you made the decision to have surgery, don't kind of focus on the negatives and on what if this, what if that. Try and be positive about it, and try not to think about it too much. And just as I say, think about the outcome and what you're hoping to achieve, and what the result you can get. That would be my advice for that. I'm not really an expert in kind of anxiety treatment but that's kind of my advice I would give to anyone. And as I say, it's completely normal to be anxious about